My name is Heather Gudino Chavez, and this is for Physical Assessment 2020.
Yes.
Hi there, Colin. My name is Heather. I'll be your nurse today. I'm just gonna wash my hands quickly and I'll be right with you.
Okay, thank you.
All right, perfect. I'm gonna close this curtain behind me. Alrighty. Can I just confirm that your name is Colin?
Yes.
What is the date of birth?
7/27/84.
Great. How are you feeling today?
Good.
Yeah? Do you know what day today is?
Yes.
Do you know the current president?
Yes, Trump.
Perfect. Patient seems conscious and alert. So today I'm going to be doing a head and toe assessment with you. I'm going to be starting with the head, okay?
Okay.
I'm going to be checking for any abnormalities. All right. Patient has no lesions, no bruises, no bumps or tenderness. No tenderness.
Okay.
All right. So then I'm going to I'm just gonna take a look at you. Hygiene looks good. Can you go ahead and sit up for me? Perfect. I'm just gonna do a few things, all right?
Mm-hmm.
The patient's posture seems good, no abnormal findings. All right, Fro. I am going to ask you to smile, raise your eyebrows. All right, puff out your cheeks. Perfect. Cranial nerve 5 seems intact. Cranial nerve 7 is also intact. All right, now I'm just going to look at your eyes. Your mucous membranes look pink. There's no abnormal discharge. Now I'm just going to do this. No signs of perla. Great. Now, can you do me a favor? Can you look up, down, side to side? Perfect. Cranial nerve 3 is intact. Cranial nerve 3 is intact. Then we're gonna go and check some things out. Alrighty. Tell me when you hear this.
Yes. Yes, I hear.
All right. Cranial nerve 6 is intact. Then I'm gonna go ahead and ask you to cover your left eye and follow my finger. Perfect. I'm gonna ask you to cover your right eye this time and follow my finger. All right, cranial nerve 2 is intact. All right, now I'm gonna tell you to open up your mouth. Patient's mucous membranes appear moist. They're pink. There's no abnormalities. There's no discharge. The uvula is midline. Now I'm going to ask you to swallow, okay? Perfect. Cranial nerve 12 is intact. And I'm going to ask you to stick out your tongue. Perfect. Now can you move it side to side? Touch the roof of your mouth. Great. Cranial nerve 10 is intact. All right, now I'm going to check your nose. They look great. The mucous membranes also look moist and pink. Can you go ahead and cover the left side of your nose? Breathe in, exhale. Great. Can you do the other one? Perfect. Nasal patency is in perfect condition. There's no deviations to the nose. Okay, now I'm going to check your ears, okay? There's no abnormal discharge, no excess cerumen. Everything is normal with the ears. Now I'm going to ask you to tell me when you can hear this.
Yes.
Perfect. Cranial nerve 8 is intact. Then I'm just going to be checking your shoulders, okay? All right. Now I'm going to push down. No, I'm gonna try lift up your shoulders and I'm gonna push down. Don't let me push you down. Perfect. Cranial nerve 11 is intact. Now I'm gonna be checking your lymph nodes, okay, Colin? All right, we're gonna be checking the submental. We're going to be touching submandibular, tonsillar, preocular, postocular, anterior cervical, posterior cervical, occipital, and supraclavicular. All right, you did great. Now I'm going to be checking your thorax. So I'm just going to ask you, bring you down. Yeah, sorry. My patient's going to lay down, and I'm going to be checking for thoracic expansion. Everything looks normal. The respiratory rate is normal, 16 breaths per minute. The depth and accessory muscle use is in good condition. And I'm going to ask you to sit right back up, and I'm just going to check your spine, okay?
Mm-hmm.
Spine alignment is great. Now I'm going to percuss for costovertebral tenderness, okay?
Mm-hmm.
No abnormal fundus, no tenderness. I'm going to palpitate for thoracic expansion now. Perfect. Now I'm going to ask you to breathe in and out. 99, 99, 99. The tactile pharmacist is in good condition. All right, now I'm going to check your breath sounds, okay, Colin? Now, every time my stethoscope touches you, I'm going to need you to inhale.
Mm-hmm.
Okay? All right, ready?
Mm-hmm.
1, 2, 3, 4, 5, 6, 7, 8. Good job. All right, now I'm going to do the same thing.
Mm-hmm.
I'm just going to aortic.
No. Still lung sounds.
Oh, the lung sounds. I'm sorry. I'm going to do the lung sounds. I'm going to check. Ready? Perfect. All right, now I'm going to check both carotid pulses done each separately for 30 seconds. Do the same on her right side. Perfect. Now I'm going to check for brutes. I'm going to auscultate. Good. Now I'm going to listen to your heart sounds, okay? And I'm just going to do it in multiple areas, and I might touch your private right here, okay? I'm going to check your aortic, doing the pulmonic. I'm going to move to your Erb's point, your tricuspid, and mitral. All right, no abnormal findings, all right? I'm going to ask you to lay down quickly. The abdomen appears flat. There's nothing ascending. Doesn't look like there's any edema. So can you tell me about how your bowel movements have been lately?
Fine.
Yeah. When was the last time you passed?
This morning.
Oh, perfect. You haven't been no tenderness.
No.
Or anything. Perfect. Now I'm just gonna hear your abdomen, okay?
Mm-hmm.
I'm gonna be listening to the right upper quadrant,
Mm-hmm.
right lower quadrant,
Mm-hmm.
left lower quadrant, and left upper quadrant. Everything sounds normal. I'm gonna be palpitating to see if there's any swelling or any tenderness, okay?
Mm-hmm.
Tell me if you feel anything.
Okay.
Right upper quadrant seems normal. Lower right quadrant seems normal. Lower left quadrant seems normal, and upper left quadrant seems normal. Alrighty, I'm gonna ask you to sit back up. Just gonna check your limbs and extremities for any edema or tenderness. Let me know if you experience tenderness. All right, perfect. I'm gonna check your fingers for capillary refills. I'm gonna check your toes for capillary refill. Perfect. I'm gonna ask you to stand up. Cross your arms across your chest. Close your eyes and stand normal. Balance and gait appear normal. There's no abnormal findings with the Romberg test. So Romberg test is negative. All right. Can you move your neck from side to side, up and down? All right. Range of motion is normal. I'm going to ask you to put your arms up and don't let me push you. Good job. Now this way. Flat. Okay, strength seems normal. I'm going to ask you to sit back down and I'm going to do the same with your legs. Don't let me push you. All right. Strength is normal on the extremities. Now I'm going to be checking your reflexes, okay? I'm going to be checking your patellar. Boing. All right, I'm going to be checking your plantar, which is going to be up on the foot.
Mm-hmm.
I'm going to be checking your triceps. So, boing. Great. I'm going to be checking your Achilles on the bottom of the ankle. I'm going to be checking your biceps. I checked your triceps. And I'm going to check your brachioradialis. Perfect. All right, now the last thing I'm going to do for you, Colin, one of the last things is I'm going to be checking your different types of pulses, okay?
Mm-hmm.
I'm going to be checking the brachioradialis,
Mm-hmm.
your radial pulse. I'm going to be checking your popliteal, which is going to be behind the knee. On your lower leg, I'm going to be checking your tibial pulse. I'm going to be checking for the posterior tibial pulse on the back of the tibia. And then I'm going to check your dorsalis pedis pulse, which is going to be on top of your foot. All right, no abnormal findings with the pulses. Now, Colin, I just want to make sure that you know you're feeling great. That I didn't make you feel uncomfortable in any way. You experienced no pain.
No.
It was a pleasure of me taking care of you. Let's lay you back down, and I'm gonna leave your call light right here next to you. And if you need me, just let me know.
Okay.
Do you need your phone or your glasses near you?
No, I'm good.
Perfect.
Thank you.
All right. It was nice seeing you. I'm Heather. I'm gonna be washing my hands.